Did you know there are 4 types of denture adhesives? In this video, I'm going to discuss the 4 different kinds of denture adhesives, and I'll let you know which ones work in which situation. And I'll give you recommendations as to when to use each type.
Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
So what are the 4 different types? Well, there's the 3 Ps. Powder, paste, and pads. And then we have the ultimate denture adhesives. Dental implants with snaps to hold the denture in. So let's start with the first P, powder adhesive. So powder adhesives are just an adhesive powder that you sprinkle on the denture and use it. These work well when the denture is brand new and has a pretty good, nice fit because the layer of powder can be very thin inside the denture. It doesn't take up a lot of space. So with a brand new denture, it's made to fit your gums and your jaw as accurately as possible. There's not a lot of extra space in there. So powders are great to try when you first start out with a new denture or a recently relined denture. They also tend to be less messy because you just shake some powder on it, shake off the excess, and then put it in your mouth. There's no paste to ooze out anywhere. It all kind of stays in the denture. So let's show you how to use the powder denture adhesive. Let's go over to the close-up cam.
So here I have a box of the powder adhesive. This is Fix-It brand. Let's open it up. And it's a big bottle. So you only need a thin layer of it. And so this bottle can, according to the directions on the box, can last you up to 4 months. So you got a lot here for the price. So you take your denture, and no matter what adhesive you use, you always want the inside of your denture to be clean. No bits of plaque, no bits of food stuck in there. You just want to be nice and clean, just the plastic, the acrylic surface. The powder adhesive, though, is a little different in that, though, instead of it being dry like you would do for the C-bond or for the paste, you actually want this wet. So I just got a bowl of water here. Just going to dip this in there just to wet the inside a little bit. Okay, now that that's a little wet, we can take the powder and just apply a little layer of it. Just sprinkle it all inside the denture. Make sure you cover everything. It's got a nice minty fresh smell too. Once you do that, shake off any excess, and now you can see you just got a thin layer of the powder inside the denture. Now you place it in your mouth and it'll work and the adhesive will go to work. Now you shouldn't have any of this is much cleaner than the paste because you shouldn't have any of this coming off into your mouth. If you do, you might not have shaken off all the excess. You just want a thin little coat of it. It's already, I can feel it sticky where it is on my fingers. So it works pretty well. Again, this is great for a brand new set of dentures if you want just a little bit of extra retention, or if it's a set of dentures that were recently relined. And so where there's a nice tight fit and there's not a big gap for thicker adhesives.
All right, next up is paste adhesive. Paste adhesives are like your Polygrip, denture cream, anything that comes in a tube that you squirt a little bit into your denture and then put it in your mouth. Because the paste is a little bit thicker than the powder, these tend to work better if your dentures are a couple years old and your gums have shrunk a little bit. Or if you have a set of immediate dentures and your gums has shrunk quite a bit, you can try using this paste instead. Pros are that it stays in very well. Cons are it is a bit messier to remove from inside the denture and also from your gums. Some people tell me they have a really hard time removing it from inside. One thing you can try using to help wipe it off, instead of using cotton rolls or toilet paper or tissues, go on Amazon or any pharmacy and get some non-woven gauze squares. I'll leave a link down in the description to them. They don't fall apart, they don't shred as much as like a tissue or cotton roll would, so cotton ball would. So you'll be able to clean up a little bit better with those. And again, let's go over to the close-up camera and I'll show you how to use them. All right, so the denture paste works a little bit differently than the denture powder. So for this, you actually want the inside of your denture to be clean and dry. So just take a tissue paper towel and dry off the inside. If you have some electronics duster stuff, compressed air, you use that to just kind of blow any moisture out of it. But basically you want this clean and dry so the adhesive can work better. And so the instructions are going to be back on the back of the tube of adhesive that you're using, but basically all the pastes are very similar. You just take it and you put some thin strips in a few spots. So I like to do 3 on the ridge and then 1 right in the middle. Now you're going to have to play with this as to how much you need. If you have not very much space, you use less of it. If you have more of a space, you use more of it. You don't want to use too much of it because it's just going to ooze out over the edges of the denture, and then it's going to be a big mess to clean up. And it's going to get stuck to your cheeks. You're going to be eating it, swallowing it. Once you have it in the denture, put the denture in your mouth, press it up into place, and go about your day. End of the night, before you go to bed, take it out, and now you got to clean this off. So some patients tell me too, it's kind of a pain to clean off the roof of your mouth or your lower jaw and inside the denture. One thing you can do that I find that works better than tissue or paper towels are non-woven gauze sponges. Now you can find these on Amazon. I'll leave a link to it down below. But basically they're just these little 2x2s. You can also get 4x4s to make them bigger. And it's just a woven material. There's no bits of cotton, you have to get the non-woven ones. The woven ones have that cotton material, kind of like similar to the consistency of a cotton ball. But then you could just use this to wipe the gel out. And it works pretty well. Might need to use a few of them to clean it all up. All right, now the third P is pads. These are items kind of like the C-bond pads, which they make for uppers and lowers. These have a bit of thickness to them, so they're much thicker than a layer of powder, much thicker than a layer of paste. So these are great if you have an older set of dentures, say your dentures are 5, 6, 7, even older years old, and you've had a bit of, your gums have shrunk quite a bit, and so the dentures are loose. Using these pads, you can kind of help fill in that space, and it also will cushion the denture a little bit. It may also work very well for immediate dentures because, again, immediate dentures, the first few months of wearing them, you're getting a huge amount of shrinkage of your jaw as it heals. So you can kind of fill this in with them. And the beauty of it is, too, if you can kind of tailor how many pads you use. Most people, 1 pad is enough. If you're somebody that's got a lot of space under the denture, you might even try using 2 or 3 at a time. I mean, I remember seeing one case where the person was using, I think, about 7 of them, but he was happy. They were working well for him. So hey, so let me show you how to use those. They're going to be a little bit different again than compared to the powder and compared to the paste. Let's go over to the close-up camera. All right, and then lastly, there's the C-bond pads. I'm just going to show you how to use it on the top one. So they come in a box. It's a 30 pack of them. And as you can see, it's basically just a paper with the adhesive kind of impregnated into it. And if you look at it close, you'll see one side is white, one side is pink. The pink side is the side that goes down onto the denture. So when you put it in, you don't want to see the pink, you want to see white. All right, so you want the adhesive inside the denture. All right, so but first, before you do anything, you need to size this up for your denture. Now they'll have the instructions. Instructions are going to be on the back of the box. But basically, you want to trim this to fit your denture. So you take some scissors and you just kind of eyeball it. Basically, you want it small enough so it fits in the denture. And so it tucks all in there. Nice. You might need to trim those little tips off. Get a little bit better fit. I'm just dry fitting it right now. Okay, that looks like that's going to work pretty well. So once you have it trimmed to fit, to use it, you got to wet this down a little bit and put it in pink side down, white side up. But before you do that, now that you've trimmed one, what you can do is take the others in the box and then trim those all up as well. And then you wet it, put it in the denture, put it in your mouth, and then you wear it. And if you trim off a bit, like I had to do on this case too, save these some. If you have a lower denture, you can actually probably use those scraps. So for the lower, you could also buy the lower ones. And do the same thing with those. Pink side down, make sure they fit, trim wherever you need to. But if you have some scraps from the upper, you can actually kind of reuse them too. Again, trim as needed. These will even work if you have a lower partial denture, where say you have your lower front teeth, but then you have a traditional removable partial denture with the metal clasps and just pink plastic in the back. You can use these little scraps in there as an adhesive. So just a little tip. Another nice thing about the pads is that they're very easy to remove out of the denture, and the cleanup's pretty minimal. There'll be a little bit of denture adhesive inside the denture and on your gums, but not as much as compared to the pastes. So the 3 Ps are all fairly inexpensive. You can get them all on your local grocery store, local drugstore, Amazon, Walmart online, pretty much wherever dental care stuff is sold. And they're inexpensive enough that you can try out each one, see which one works best for your situation, and give them a try. If none of the 3 work well, it's probably best to see your dentist. It may be time to have your denture relined or even have a new denture made. Even if a new denture or a reline doesn't help though, then there's always the last ultimate denture adhesive, dental implants. On the lower, if you get 2 dental implants with some snaps that fit into your lower denture, it will stay in so much better than any of the other adhesives can do. Same thing on top. If you're having trouble with your upper denture, 4 implants on top with snaps and an overdenture, and it'll stay in very securely. The overdenture can even be made without covering the roof of your mouth, so that you can taste your food better and it just feels better in your mouth. Downside is though, this is going to be the most expensive option. You're going to have to get implants, you're going to have to get a new overdenture with a metal framework made, and you're going to need the implant posts and snaps, and then have it all put together. I did make a video going over the costs of it, so I'll leave a link to that in the description or up here on the card so you guys can check it out as well. So I hope you guys found this video informative. Please hit the like button, it really helps me out. And also, if you want to learn more dental information, consider subscribing to my channel. Thank you so much. See you in the next video.